I've been able to see how this organization has decided to take on the challenge of transformation, which is so difficult because in so many ways you want to honor the systems and the culture and the giants that help get you there. But like there's this Marshall Goldsmith quote that says, what got you here is not going to get you there. And we're all very aware of strong brands that decided not to make that decision. And now AOS has more, if not the most options, which is you can take it virtually, you can take it in, you can take the didactic in person and benchtop, or you can actually see patients. And then move up even more levels to intermediate, and they have retreats. You're not learning one system, you're learning orthodontics. Everybody leaves basic changed because they understand the mouth just that much better. They understand orthodontics, they understand airway, they understand prosthodontics. Because you cover phase 1 and phase 2, they understand development. He's like a kid. I think he's found the thing that he loves the most. I don't know if anyone is old enough to remember the Rudolph the Red-Nosed Reindeer story with that little kid that wanted to be a dentist. Because I had never known anyone that wanted to be a dentist from being a kid, but he is one of them. And it's just very inspiring how much he loves what he does. It's infectious. How could you not want to learn from somebody who loves what they do that much, and you happen to be learning the same thing?
I'm Dr. Tran. I am practicing in Dallas, Texas. I'm a general dentist. I have always wanted to do cosmetic cases, and a lot of the cosmetic cases that I try and achieve is almost unachievable because of the way that the teeth are orientated. It not maybe angulate the right way. We can do as much crowns and bridges as we can, but at the end of the day, it's not as easy just doing cosmetic without actually correcting the real problem. Because of those obstacles, I started to investigate of how I can serve my patient better. Dr. Harrington talked to me about this amazing program that he'd been studying for almost 2 years. He loved the ortho case being presented. Dr. Williams are treating patients in phase 1 all the way up to phase 2, and sometimes even some elderly patient, which is basically the population that we are serving in our office. This is being taught by a general dentist, just like me, serving the patient base just like our office. I found my solution for a lot of the cosmetic cases that I've been wanting to treat, but doesn't have the right solution for. I really want to see how it look like with real patient. That's when I found out that Dr. William do offer a course that is hand-on with actual patient. That way we can actually see the progress of what we learn. This CA course is probably the most unique one because it was taught by a general dentist who not only have so much knowledge in orthodontics, but also in everything else that are related to orthodontics. We discussed perio and how that's related to ortho. We discussed endo and how that related to ortho. If you want to get something, if you want to learn something and learn it right, this course is probably the best course that you can pick, because we are seeing about 4 to 5 patients, but we're following through the entire course of their orthodontic treatment. I invest a lot of my time and effort into this course because when your patients are finished with the case and you see that big smile on their face, you know that you did it right. So on the clinical day, we are the main provider who will be putting on wire. We put on anything that are placed on the patients are being done by you. That way you not only get hand-on experience, you also learn what is hard for you, and you can actually go back home. And so on the week that you are not here, there are homework at home that will tie with what you are doing on your patients. You really only learn by doing it, and we know that in dentistry because everything we do is with our hand. And so you cannot learn without having that eyes and hand memory. The whole journey that I've been here, and the fact that I have the knowledge, I am very confident that once I'm done with this course, I will be able to start my own case and able to follow up with my patient from what I learned from here.
Hi, I'm Christine Lung. I'm a pediatric dentist from outside of Toronto. I've been practicing for 4 years, and in the past 3 years, I became interested in orthodontics. My pediatric residency, we didn't have a great orthodontic program, but one of my mentors there had mentioned the AOS. Yeah, I took the basic course, and then I started to monitor it, and then I heard about the premier course that was coming out, so I decided to do that because I think the best way to learn is hands-on. I think the premier course was attractive because there are a lot of dentists who were very motivated to do some hands-on orthodontics also. And there was also an opportunity to get some mentorship and review cases. The case reviews were very important to me because I worried a lot about not having confidence to proceed with some cases and not having the mentorship to carry through an entire case. For someone who is interested in the premier course, I would say that it's more for those who are very serious about orthodontics. The premier course is very helpful. Things are very different when you're just working with a typodont because, it's like when you're in dental school and you're doing stuff benchtop, it's very different when you transfer to a patient. I put in my first NPE in a patient last week and it was very challenging. It's helpful to have some feedback and get some, advice, before and after, and to kind of analyze what I would do differently. I think over the shoulder is a little bit different. For example, here's a good example. When we're using the spring separators, watching people put them on and take them off looks like so easy, but when you try to do it yourself, it's quite challenging. So when we started using those here, we struggled a lot, and then having someone show us and trying it again was very helpful. I have several cases going right now, and when you're in it, you start to see all these subtle details, and you think about things a little bit differently. I started my first cases in Premier after getting the green light. So you present your case to Dr. Brad and you get some feedback from your peers, and you're talking about, all the potential things that could go wrong and all the things that might be easy, and then you're kind of weighing the options, and you talk to the patient, are they easy to work with? As someone who just started orthodontics, you are not very sure about a lot of things, so you always want some validation or some feedback on what you're doing right. I think having that confidence early on is very hard. We reach out to Dr. Brad if we have questions. He's always very good answering emails, especially if you send photos or x-rays. He will be very helpful with that. I think that the most important thing I learned in this course was case selection and diagnosis. Everything is very standardized, and we all are following the same kind of recipe book, if you will, in terms of case selection.